Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of x-rays.
Working in an X-ray department is unique in the sense that the patient population is comprised of individuals from various departments or locations. Whether or not radiology personnel remain in the department itself or are charged to travel to various floors or location, X-ray staff members contend with exposure to different classifications of patients. This means that X-ray specialists are highly transient, cross-pollinating into the various specialties of medicine. This cross-pollinating into various settings can create risk in some environments. If an X-ray professional treats a patient with a highly transmittable disease, it is their responsibility to take the appropriate steps to prevent the spread of infection from one patient to another. Treating an influenza patient and following up with a cardiac patient can have negative consequences if medical protocol isn't adhered to. The coronavirus, or COVID-19, is a virus that is highly transmittable via droplets or surface contact. Professionals must recognize these two mechanisms in order to protect themselves and the patient. When treating a patient who is positive for coronavirus, technologists must remain aware of all points of contact within the environment. According to the guidelines of the organization, most staff must wear masks, gloves, and eye shields. The eye shield can be goggles or a face guard that will prevent splashes. The mask and gloves will protect both employee and patient from aerosol, cough, and surface contact. Some organizations may mandate that the X-ray staff wear isolation gowns for further precaution. This is especially true if the patient is on a ventilator, which can harbor additional risk in splashing. If a patient is not on a ventilator, it is recommended that both the patient wear a mask along with the professional during the procedure. The need for a protective gown may not be as prevalent in this circumstance. If any part of the X-ray equipment requires contact with the patient during the examination, that equipment must be provided with a barrier. This can be an organization-sanctioned shield, a thick plastic covering, or in some cases, a clean pillowcase or sheet from a fresh linen cart. Patients must be given explicit instructions, including where to place or keep their hands and extremities, when to sit or stand up, and when to change their breathing. Not communicating to the patient can, in and of itself, create the possibility of cross-contamination. When the examination is complete, the X-ray operator must carefully separate the equipment from the patient, disposing of the barriers in either a linen hamper or a designated trash bin. The professional then removes their gloves and gown and disposes of them in an appropriate receptacle within the examination room. They can remove their goggles in the same way if the goggles are disposable. Next, they can immediately clean the X-ray equipment with a recommended disinfectant. In the case of mobile X-ray, the X-ray tube, switch, console, and arm must be wiped down thoroughly. In some environments, a separate wipe would be administered to the wheels of the device if it has been rolled into an infectious setting. Once the technologist has completed these tasks, they must wash their hands with soap for 20 seconds. These steps will help to ensure that technologists will remain protected in their work environments. It will also help to curb nosocomial infections within the workplace. Hospitals, clinics, and specialty centers have a responsibility to enforce these types of protocols in their settings. They may not adhere to the exact same precautions, but they should have standards in place. Healthcare workers must have ready standards and protective measures for them so that they can continue their work without marginal concerns for their safety. With adequate management and protocols in place, healthcare providers can realize an effective and safe workplace for all. That concludes our video on X-rays and the coronavirus.
If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the radiology coach. And remember, mark my word and mark your films.